Hello all, my name is Nico Hahn, and I've partnered with the South Central Foundation, a nonprofit organization based in Anchorage, Alaska, that serves Alaska Native and American Indian communities. Today, I'm presenting as part of our Take Charge of Your Life series, and today's topic is type 2 diabetes. This is Battle in the Body, the fight against type 2 diabetes. My goal today is to give you the knowledge and tools you need to take control of your health. Let's get started. Before we get into it, let me walk you through what we're going to cover today. The goal of this presentation is to educate you on type 2 diabetes. By the end of it, you should walk away with 4 things. First, a solid understanding of diabetes and type 2 diabetes. Second, knowledge and risk factors associated with diabetes. Third, a clear sense of your own personal responsibility towards your health, since you are the most important member of your own health team. Lastly, an understanding of the complications that come with diabetes and why having a healthcare provider in your corner is so important. Starting strong with the basics. What even is type 2 diabetes? Diabetes mellitus is a chronic condition where the body cannot properly regulate blood sugar, either due to lack of insulin or the body not responding to insulin. Type 2 diabetes, which will be referred to as T2DM on the slides, is most common, affecting an estimated 529 million people globally in 2021 and is expected to exceed 1.3 billion by 2050. It is most commonly diagnosed in adults aged 35 to 64, is driven by insulin resistance and lifestyle factors, some examples of which are diet, physical inactivity, and obesity, and is treated with lifestyle changes, oral medications like metformin, and sometimes insulin. The table on the top right of the slide, Figure 1, breaks down diabetes prevalence by ethnic group for both men and women. What stands out immediately is that non-Hispanic indigenous people, which includes Alaska Natives, have the highest diabetes prevalence of any other group shown. Indigenous men show a prevalence of 19.7% and Indigenous women at 18.8%, which are both significantly higher than non-Hispanic white men at 9% and women at 7.6%. That's more than double the rate. As you move down the table, you can see that every other racial group falls somewhere in between, but none come close to the rates seen in Indigenous communities. When it comes to Alaska Native women, they're disproportionately affected by type 2 diabetes compared to others. Diabetes prevalence among Alaska Natives increased by over 175% between 1985 and 2006, and Alaska Native women specifically show markedly higher rates of obesity and prediabetes, which are major drivers of type 2 diabetes compared to their male counterparts. Now that we know and understand type 2 diabetes, let's talk about the risks that come with developing it, and what other health conditions tend to go along with it. For our target population, Alaska Native women, 2 risk factors stand out the most. The first is obesity. Obesity is one of the strongest known risk factors for type 2 diabetes, and Alaska Native women show particularly high rates of obesity and central adiposity, meaning excess weight carried around in the midsection. Research confirms that obesity, abdominal fat, and metabolic syndrome all independently increase diabetes risk among Alaska Native adults, with women showing even greater rates of obesity than men. The second risk factor is sedentary lifestyle and poor diet. Between 1995 and 2006, obesity among American Indian and Alaska Native populations increased by over 25%, driven by a shift towards more sedentary behavior and processed high-sugar diets. Both changes are directly tied to rising type 2 diabetes rates in this community. Then there's comorbidity, meaning a condition that commonly exists alongside diabetes. For Alaska Native women, that condition is hypertension, or high blood pressure. Among Alaska Native and American Indian adults with diabetes, hypertension was present in 78% of cases, making it the single most common co-occurring condition. Alaska Native adults are 1.1 times more likely to have high blood pressure than non-Hispanic white adults, and when hypertension and diabetes occur together, the risk of cardiovascular disease and serious complications goes up significantly. So as you can see, these conditions are not independent from one another. They feed into each other, which is exactly why early intervention matters so much. Now that we know the risks, let's talk about what you can do about it. I want to start by explaining this clearly. No doctor, nurse, or dietitian can manage your diabetes for you. Your daily choices are the most powerful tool you have. Showing up to appointments, tracking your blood sugar, and making lifestyle changes, that's all on you, and that's a good thing because it means that you have the real control here. There are two main methods we'll highlight for controlling your type 2 diabetes. The first is diet and exercise. Weight loss through calorie restriction combined with increased physical activity is one of the most effective ways to improve blood sugar control, and research shows it can even lead to remission in some cases. The goal doesn't have to be dramatic. Aim for balanced meals, low in processed sugar, and at least 30 minutes of movement most days. The second method is reducing or quitting smoking. This one often gets overlooked when talking about diabetes, but smoking directly increases insulin resistance and makes blood sugar much harder to control. Research shows that quitting smoking can improve cardiovascular outcomes, lower HbA1c levels, and reduce the risk of serious diabetes complications. If you smoke, talk to your doctor about different changes you can make in your life. One small conversation can make a substantial change within your health. Even with all these tools available, not everyone has equal access to care, which is a huge issue. For Alaska Native women specifically, there are two major gaps. The first is a lack of health counseling. Alaska Native and American Indian adults experience higher rates of both type 2 diabetes and mental health challenges than the general U.S. population, yet very few programs have addressed both issues together. Mental health and physical health are deeply connected, and ignoring one makes the other hard to manage. The second gap is cost and insurance barriers. Structural barriers like poverty, discrimination in healthcare delivery, and high out-of-pocket costs make it significantly harder for Alaska Native women to access the preventive screenings and ongoing care they need. This just goes to show exactly why having a primary care physician is important. This is someone who knows your history and can advocate for you. Don't wait until something is wrong to seek care. Let's talk about exercise. Movement is one of the most powerful tools you have when it comes to managing type 2 diabetes. First and foremost, before you start any new exercise routine, especially if you haven't been active in a while, please check in with your healthcare provider. They can help figure out what's safe for your body, set realistic goals, and flag any risks specific to your situation. Your goals don't need to be some huge change that interrupts your entire lifestyle either. Even tiny amounts of weight loss and moderate movement can make a meaningful difference in your blood sugar control. So, what does exercise even do for your body? When you move your muscles, they use glucose directly for energy. This lowers your blood sugar instantly and improves how your body responds to insulin over time. Research shows that regular exercise improves blood glucose levels, body weight, blood pressure, cardiovascular health, and overall quality of life in people with type 2 diabetes. Some types of exercise you can try are aerobics, strength training, and flexibility. Aerobics like walking, swimming, and cycling boost heart health and insulin sensitivity. You should aim for at least 150 minutes per week. Strength training, such as weights and resistance bands, improves insulin sensitivity, muscle mass, and blood sugar control by 10 to 15%, which is especially great in older adults. Finally, flexibility training like stretching or yoga improves range of motion and is a beginner-friendly starting point. Bottom line, find something you enjoy personally. Start small, stay consistent, and always keep your doctor in the loop before jumping in the deep end. Next, we need to talk about nutrition. What you eat directly affects your blood sugar every single day. Having a meal plan takes the guesswork out of eating well, and you don't need to count calories or measure portions to do it right. When you plan ahead, you're less likely to reach for processed, high-sugar foods in the moment. Small, sustainable changes to what and how much you eat can have a real impact on your blood sugar levels over time. The key is having a plan so that healthy choices become the easy choices. The American Diabetes Association has made it simple with something called the Diabetes Plate Method. Here's how it works. Start with a standard 9-inch plate and divide it into sections. Half your plate should be non-starchy vegetables. Think broccoli, spinach, carrots, peppers. These are high in fiber, low in carbs, and won't spike your blood sugar. A quarter of your plate should be lean protein: chicken, fish, eggs, tofu, or beans. They'll help you stay full without affecting blood glucose much. The last quarter is for quality carbs like whole grains, starchy vegetables, fruit, or low-fat dairy, which gives you energy while keeping portions in check. And for your drink, stick to water or zero-calorie beverages only. Looking past your plate, there are 3 key nutrient deficiencies that are common in people with type 2 diabetes, and it can make blood sugar control worse. The first is vitamin D, and low levels are linked to increased insulin resistance. The second is magnesium. It's a core component for insulin to properly function, and low levels worsen glycemic control. The third is vitamin B12, which is especially important if taking metformin, since it's known to deplete B12 levels over time. So, eating well isn't just about cutting sugar. It's about making sure your body has everything it needs to manage diabetes effectively. When diabetes goes unmanaged, the complications are serious and affect nearly every system in the body, starting with the most common complications. Neuropathy is nerve damage that causes pain, numbness, or tingling, most commonly in the feet. This is one of the earliest and most common complications of type 2 diabetes. Diabetic foot and amputation are in tandem. When circulation is poor and nerves are damaged, small wounds can go unnoticed and turn into serious ulcers that may require amputation. Eye disease, or retinopathy, happens when high blood sugar damages the tiny blood vessels in the eye. If left untreated, this can turn into blindness. Kidney disease, also called nephropathy, develops when chronically high blood sugar slowly destroys kidney function over time. Lastly, cardiovascular disease such as heart attack and stroke remain the leading cause of death among those with type 2 diabetes. Looping back to our target population, Alaska Native women with type 2 diabetes face these complications at disproportionately high rates. Among Alaska Natives with diabetes, the incidence of stroke was 10.6 per 1,000 person years, with women experiencing higher rates than men. Lower extremity amputations occurred at a rate of 5 per 1,000 person years, and cardiovascular disease was the most common cause of death, followed by cancer. The good news is that with improved care programs, rate of amputation and kidney failure have declined in this community. This proves intervention works, but only if you're getting care. I want to close out with something really important: how public health actually approaches preventing and managing type 2 diabetes. It all comes down to 3 levels of prevention. Public health uses these 3 approaches to prevent adverse health outcomes, reduce disability, and design interventions that reach people at every stage of the disease. The key idea is that the earlier you intervene, the greater the potential impact. First is primary prevention. This happens before diabetes ever develops. The goal here is simple: stop it from occurring in the first place. For Alaska Native women, this means using the diabetes plate method from earlier, staying active through walking, swimming, or strength training, and working towards a healthy weight. You don't have to make huge changes overnight. Small, consistent habits are what usually stick. The second is secondary prevention. This kicks in once someone has been identified as high risk or as pre-diabetes, but before full diabetes develops. At this stage, regular blood sugar screenings and HbA1c testing are critical. If you've been told you have prediabetes, talk to your doctor about metformin and look into enrolling in the CDC's National Diabetes Prevention Program. It's free, it's proven, and it's designed for people exactly like you. Third is tertiary prevention. This is for those who have already been diagnosed with type 2 diabetes. The goal now is to manage the diabetes and prevent serious complications like blindness, kidney failure, and amputation. This means daily blood sugar monitoring, medications like metformin or GLP-1s such as Ozempic, and regular foot and eye exams. Your care team is your friend here, but again, you're the most important member of that team. To wrap everything up, type 2 diabetes is serious, but not a life sentence. Whether you're trying to prevent it, slow it down, or manage it, there are real tools and real resources available to you. I encourage you to keep learning and reading about your health. Two great places to start are the American Diabetes Association at diabetes.org and the CDC's National Diabetes Prevention Program at cdc.gov's Diabetes Prevention page. Both are free, easy to navigate, and full of useful information specifically for those managing or trying to prevent type 2 diabetes. To finish, here's all the sources I used throughout my presentation for those who wish to delve deeper into the research. Thank you for listening. My name is Nico Hahn, and remember to take charge of your life.